I'm Curt Lox. I'm currently the Dean of the School of Education, Health and Human Behavior, and I've been at the university since 1996. And I've worn a number of different hats during that time. Started off as a faculty member, was the Associate Dean in the school, Department Chair in Kinesiology and Health Education, and now Dean of the school. The opportunity was there some years ago to become Associate Dean and to be able to impact more than just a single department, but to impact multiple departments and multiple faculty members and students is really a lot of fun. It stretched me, I learned a lot, and now I kind of feel like I can give back and have a bigger impact as an administrator. We're very diverse, which I think is a strength of ours, hence the name change that we had recently to School of Education, Health and Human Behavior. So we have all the teacher preparation and administrative preparation programs you would expect out of most School of Eds, but we also have departments of psychology, Department of Kinesiology and Health Education, and they have exercise science and nutrition, public health, these sorts of programs. And then we also have communication disorders, so speech pathology and audiology, those type of programs, which you won't find a lot of those programs in schools like ours and in many places. The curriculum we're offering is very different. How we're offering and delivering the curriculum is very different, whether we're on campus, off campus, online, hybrid, that's changed dramatically. I'm really proud of the different sorts of clinics and programs that we run out of the school where we bring the community to us, to the campus. And we're currently standing in one right now. This is our exercise physiology laboratory, and there's many different aspects to it. But we do run the weight management program partially out of here. We do a lot of the testing and the exercise in here. If you go to our exercise physiology laboratory, we didn't even in the past have a biochemistry element to it. Now we have that and have recently expanded it to about 3 times its size. We've also got the speech language hearing clinic, we have our attention behavior clinic, we have our cougar literacy clinic, and our math hotline. So all throughout the school in different buildings, we're constantly welcoming the community to campus and working with them, which has been really exciting. And we have a long tradition of doing that sort of work. I try to make sure that I bring a level of optimism and energy and enthusiasm to the job every day. And I'd like to think that if you talk to people who've worked with me at any stage of my career, they would say that. And I feel like that can be contagious and that can spread, and that's what you need. I think if you have that, you can be successful no matter what obstacles you're coming up against. I really believe that. I want people to know and feel as if I was the right person at the right time for the school. When things were seemingly very challenging and money was tight and there was all sorts of reasons to kind of throw up your hands, I made sure and have made sure that I don't do that. I don't get dissuaded, I don't get dismayed. I'm just not that person, I'm not built that way. I'm always looking to figure out how our school can be better and do things better and better serve our students. And in a competitive environment, if we're not thinking that way, we're going to fall behind, and we can't afford to do that. So I push myself and I push everybody else in the school pretty regularly, and we've talked about becoming comfortable with being uncomfortable. And I think that sort of mentality is what I'm trying to carry forward, because it's going to take a different mentality, a different way of doing things to be successful in higher ed going forward.